Again, my next talk is on regenerative medicine. So certain things that have come in, there are certain things that I practice, certain things I don't practice, which I hope to practice soon. And basically, I'll start with GCSF, not much to say. I'll just keep it as short as this. It's basically a growth factor working on granulocytes. So the basic concept of how it works is it works in recruitment neutrophils, causes vascular remodeling, endometrial proliferation, and uterine gland transformation. Hence, it leads to used by hematologists to separate the mesenchymal stem cells from the bone marrow. So when you use fecal gradient, you need 50 to 60 ml of bone marrow aspirate for the entire process because it uses a lot more media, because you use RPMI, use bovine serum medias, and a lot of other medias also there. Okay, just one second, just answer. Okay. So basically, in red cell lysis media, the similar media is used, wherein bovine serum uses a lot less. So they find it cheaper to do it with red cell lysis media rather than fecal gradient. And the most important thing, the pricing comes second because they're both expensive, but the pain factor is so much when you do. And when you want 60 ml, when you're putting into the PSIS, and once the tip of it breaks, finding the other location to make it enter easily is a lot more difficult. Thank you.